Today we're just going to do a quick overview of the DASH, which stands for Disabilities of the Arm, Shoulder and Hand. It's a self-reported questionnaire used to measure a patient's symptoms and functional limitations in the upper limb, making it highly relevant for shoulder rehabilitation. Now, what is the DASH? It's a 30-item questionnaire covering everyday tasks, work, sport, music activities involving the arm, the shoulder, and hand. Patients rate difficulty and symptoms, pain, weakness, stiffness, tingling on a 5-point Likert scale. Now, scores are converted to a 0 to 100 scale. So 0 equals no disability, 100 equals severe disability. There's also a shorter version called the Quick Dash, which only has 11 items, and that's for faster use in busy clinical settings. So why is the DASH useful in shoulder rehab? Now, for sports therapists, the DASH helps to capture the patient's perspective. It reflects how shoulder problems affect real-world function, so lifting, dressing, pushing, sports skills, and work tasks. You can track change over time. So completing the DASH at baseline and during rehab lets you see whether your management is actually improving function and not just reducing pain. It will support clinical reasoning and return to play. So failing scores can show improved capacity and can complement strength, ROM, and performance tests in return to play decisions. Now, persistent high scores may flag ongoing limitations or psychosocial barriers which need reviewing. Communication and justified care. So DASH scores provide objective, standardized data you can use in multidisciplinary team discussions, referral letters, audits, service evaluation, and case reports. Now let's get a little bit critical about the DASH. Even though this is a really reliable, valid tool, there's always some negative aspects of it that you must be aware of. Now, it was designed as a broad functional outcome measure, not a shoulder-specific or sport-specific tool. So the key issues is a lot of activities or items are everyday activities. So dressing, cutting food, cleaning, leisure tasks. For many athletes and active patients, these recover early, so their DASH score can look good, while higher level or overhead sport demands are still limited. Now, they did a 2022 systematic review of upper limb questionnaires, and the link is in the bio of this video. Now, DASH and Quick Dash are among the most frequently tested with general kind of adequate reliability and responsiveness. But most tools, including DASH, focus more on activity participation than pure physical function. And no single questionnaire is perfect across all psychometric properties. Now, content and psychometric evaluations. So the takeaway message is DASH will tell you how upper limb problems impact daily life, not exactly how game ready a shoulder is. So it's really important just to realize that when you use this with athletes.